to the show. And yes, in case you're wondering, we started this show. Yeah, the show has been on a while back, but we sort of had a bit of a rebirth, so to say. I'm talking about the MYSD Spectrum. MYSD Spectrum, Minister of Youth, and MYSD, Minister of Youth and Social Development. Yes, we have to get that correctly so that we don't mix it up. Yes, indeed. And of course, this show throws light on the activities and everything as regards the Minister of Youth and Social Development. Welcome to MYSD Spectrum. And of course, today we are going to be beaming our searchlight on a particular unit. I know a unit is part of a department, of course. Yes, so today our focus will be on a certain unit, and it has to do with drugs, kicking against drug and substance abuse. You will agree with me that that is a menace that has, pervaded the entire fabric of society. Now our focus is on Lagos State. All right, with me we have two very, very wonderful guests. Of course, I'll be introducing them right up. And we have Mr. L.O. Kotun. He is the Deputy Director, Head of LASKADA. You're welcome, Mr. Kotun.
Good afternoon.
Okay, I'd like for you to come close to your microphone. That's your microphone, and so that Lagosians will be able to hear you better. You're welcome, and it's so great having you on the show with us. Of course, LASKADA. When I hear LASKADA, a lot of ideas are coming. And when I now saw what it means, kicking against drug and substance abuse, we think of how important this is in society. Also with us on the show to beam our searchlight on the moves of the Lagos State government, in stopping this menace that has eaten into the fabric of our society. We have Mrs. Olaiya Martha. She is a principal social welfare officer right there in the unit also. You're welcome.
Thank you very much.
Yeah, so great to have you with us. All right, so by way of, creating a bit of a foundation, can we talk about the unit? What brought about this? What informed the creation of the unit? How long has it been? And let's just talk about that first of all.
Thank you very much. LASKADA means Lagos State Kick Against Drug Abuse.
Yes, kick against drug
It's
abuse.
been on for a while, but got into moribund. But as a result of the surge of drug abuse in the state,
Yes,
the ministry now realized there is need for the rebirth
okay,
and re-engineering of that particular unit. So it's under the Rehabilitation Department of
okay.
the
When did this
state.
rebirth happen?
April this year.
April this year. Okay,
So
that's like a couple of months ago.
yes,
This is
about
when July.
3-4 months ago.
Yes.
So there is need to fight this menace of drug abuse and substance use among the youth. So it's not a state problem. We realize it's a global pandemic
Yes.
that needs to be tackled with all resources, and all hands must be on deck to make sure we fight this. So that is why this was called a special unit dedicated for the fight of drug and substance abuse in the state.
Wow. Okay, so basically LASKADA's role is, to address the drug and substance abuse menace. Of course, we primarily focus on Lagos State because that's our core.
Yes,
but of
focus
course,
on Lagos State.
Yes.
But I must distinguish one thing. LASKADA is not an enforcement agency.
You're not an enforcement agency, of course.
Yes, the role of enforcement is saddled with NDLEA.
NDLEA, okay, but you partner with.
So we partner with their major partners.
Okay. Would it be possible that we have, if you have access to some statistics or data on, because it's easy to say, oh, it's a menace, it's this, is that, but can you share some statistics or data off the cuff on the prevalence of drug and substance abuse in Lagos and why it's a pressing concern?
It is a pressing concern because most of the victims,
Yes.
or most of the addicts,
Yes.
are young people.
True.
And these are supposed to be our future leaders. So if the government do not do anything or do not act, that means we're having a bleak future So
we have
that
a
is
problem on our hands.
Yes, we have a problem that needs to be tackled. So if not, all our investment now will go into shambles, because there won't be anyone to take over from this present generation.
True. Mrs. Olaiya Martha, okay, you're not done.
Talking
Please go
about
on.
your statistics.
Yes.
I would say out of every 10 young person,
Out of every 10 young persons,
7 of them are on drugs.
wow, that's an alarming statistic.
Yes. And in Lagos State, as at today, the prevalence of drug addiction and substance abuse is more prevalent in Mushin.
So that's like the epicenter.
Yes.
Oh, quite alarming. That's quite alarming. Okay, now the 7 out of 10, is that Lagos or Nigeria?
We're giving you statistics of Lagos. But it's a global pandemic.
Of course, we all know. We all know that. Mrs. Olaiya Martha, I'll be turning my attention to you. Of course, this unit, yes, it's a crack unit, because the work put in your hand is really, really, really big, and it's strategic and vital. Are there any structures in place? Are there strategies employed to prevent substance abuse among young people in Lagos State? How's the unit doing that?
Okay, we have like 4 different programs that we run.
4 programs, okay.
Yes, that we run in the units. We have the preventive program.
We
have the advocacy program.
Okay.
We have the specialized program, and we have the partnership program.
Okay.
So partnership and collaboration.
Okay.
So like the preventive program, we have we talk about what's it called, drugs abuse. We go to schools. Let me put it in short. We go to schools.
Okay.
We talk to them. We've been to what's it called, Mafoluku Grammar School.
Okay.
We've been to Orile Agege Junior High School to sensitize them about drug abuse. And funny enough, the results we get there is quite alarming, because for secondary school student, let me say junior secondary school students, giving us different names
of drugs
that they know that we have not heard of before. Like now, drugs comes in different forms. They come in candies.
Yeah.
They come in chocolates. They call
That's
some
against earlier when it was just the one they smoke.
only smoke weed, SK.
Yes.
But now it's not SK. Now you hear ice, you hear balloon.
Wow.
You hear candy. You hear different things right now.
I'm sure your team must have heard so many names.
And coming out from junior secondary schools,
yes.
No, it's not easy. It's not something you would want to hear or you would want your children to go into.
Okay.
So then we do collaboration with NDLA, with MTN, and other partners. We have other different partners.
Like collaborate with.
Yes, like LASU now. We had LASU like 2 weeks ago to sensitize students about drug abuse. Then we had the program with UNILAC. Then
that was the event with was that the one with the first lady?
The one with the first lady is LASU.
Okay, that's LASU. Okay.
Yes.
Okay.
The one the one at UNILAG is
with MTN
and NDLA as well.
Okay.
Because June 26th is a day of International Drug Day.
Oh, okay. So it was celebrated all over the world. It's not just Nigeria.
It wasn't just Nigeria.
Okay. Aside schools, collaborating with schools, are there, because I know most of these children, they come from homes, they come from communities. Are there any outreaches or collaboration with community organizations or maybe, the community itself?
Yes, we do that.
Okay.
But the thing is, we want to focus on the school.
On the schools, okay.
First. By the time we'll focus on the school, then we can have a say with the community. The school children that we've spoken to, educated already, would be the ones in the community as well.
Yeah.
They can tell their parents what they've learned in school and other stuff like that. So
all right, dear listener, I'm sure you would want to weigh in on this very important topic. Feel free to connect with us. We have people from LASKADA. Yes, they're here and they're sensitizing us and telling us about their activities and all they do down there at the unit. LASKADA is the Lagos State's Kick Against Drug and Substance Abuse. Mr. Kotun, Deputy Director and Head of LASKADA, is here. And also we have Mrs. Olaiya Martha, who, of course, is the Principal Social Welfare Officer is doing a great job of, shedding light on this very, very important issue, which, of course, it is a menace. From the statistic we're provided with, which is really scary, 7 out of every 10. That is something to worry about. And okay, so moving ahead, Mr. Kotun, parents and caregivers, what role do you think they play, or what role do you feel they should play in preventing substance abuse, and what advice would you offer to them?
They have a great role to play in this fight against drug abuse. Like she's rightly said, one of our 4 focal points, the preventive advocacy specialized program. Our specialized program focus on parenting.
Okay.
There is need for parents to be aware of some of these vices or some of the things that are going on. Don't just trust your child. Don't just be relaxed that yes, I've trained him well. Training is not only in the house.
Yes.
They have peers, there are peer pressures, and nowadays parents are not even there to even perform their role
Because they're trying to make ends meet.
So these children learn from either the social media, peer influence, and so many other things. So as part of our effort in trying to fight this, our specialized program tailors around parenting.
Okay.
So by the time we start the parenting prevention program, we'll be calling on parents through parent-teacher association in schools, community CDAs, and all that. We'll be able to enlighten and let them know signs that they need to watch out for.
At least from the home front.
From the home front, and why they need to speak out when they notice anything.
Okay. Now, we've been talking prevention. Are there support services? Let's just look at people who are already in there. People who are struggling with substance abuse. I don't know. Does your unit have anything to do with support for
It's
them?
part of yes, it's part of our specialized program.
Okay.
Part of the specialized program is the support service.
Support service. Okay.
We have rehabilitation centers. We have 2 rehabilitation centers for drug dependents in the state.
Okay.
We have one at Isheri, Rehabilitation and Training Center.
Okay.
Isheri.
Yes.
And we have another one, Tajuddin Olusi Rehabilitation Center.
Okay.
At Aja.
Okay.
So these 2 centers are government run, and we have other private rehabilitation center in the state as well, that are licensed by the ministry.
Okay. NGOs run.
Yes.
Okay.
They are licensed and supervised by the ministry.
So of course they have to get approvals from
the Ministry of Youth and Social Development before they are established.
So even the faith-based ones,
they
need to have,
of course,
some sort of
once
approval.
you operate in Lagos,
yes,
you must have an approval.
Okay. Okay, I have a question on WhatsApp. I think this person is tying it to what you just said. How can we access these services through LASKADA? How can we access these services? How do you?
Yes, they can visit our office or call our phone number.
Okay. Can we just have that real quick?
090.
Okay. Okay, while you try to pull that up, let's just take a traffic update while you pull that up. The Maryland Ikeja GRA axis at this time from Anthony Inwards Journey, Maryland intersection on route Odoyalaru. The update at this time is that it's a busy one due to, of course, we all know that the Fakol link, that the expansion joint is being worked on. So as a result of this, the Kodu Road is an alternative. So it is quite busy. And Mobolaji Bank Anthony Wayne was Sheraton is looking good, while from Sheraton in was Johnny Lassuth underneath the bridge is busy at the moment. But we have traffic managers very much on ground doing the needful around that axis, making sure things move as smoothly as possible. All right, you're about to give us some numbers for those who perhaps want to reach out.
Yes, 003 0903.
Okay.
931 9183
0903 931 9183. Okay.
And they can also send a mail to us.
Okay, what's the email address?
LASKADA.
So let's spell the LASKADA for the benefit of people, because this person wrote LASC. So yes, it's LASKADA
unit UNIT at gmail.com.
So LASKADA unit gmail.com.
And they can follow us. They can send a DM to. They can DM us on laskada.gov.ng.
Okay.
On both Instagram and TikTok.
Yes. So I'm curious. I'll just be addressing you, Ms. Mata. Can you describe the rehabilitation programs? Just describe them of the programs offered by LASKADA. And I don't know, I'm curious, what outcomes have you seen in individuals who have gone through these programs?
Wow. Let me start with, the program is for 6 months.
6 months, okay.
The first process is for you to write a letter to the permanent secretary.
First of all.
Yes, the permanent secretary, Ministry of Youth and Social Development, Block 18, Secretariat Alausa.
Okay.
Then once you write a letter to the PS stating what you want, then you get a call from the rehabilitation unit, not from LASKADA. Our own is to do much of advocacy and counseling.
Right.
So once you write a letter to the PS and they approve it, they get in touch with you.
Okay.
They visit your home to know the status of your child.
Okay.
And they admit the child into the rehabilitation home.
Okay.
So once they admit the child into the rehabilitation home, we have doctors there, we have nutritionists, we have a lot of professionals there. So they go through a program for 6 months.
Okay.
And once they are okay, they let them go back to the society to mingle.
How do you monitor to make sure that they have been rehabilitated, sufficiently to be able to reintegrate into society? Some of them, it's not possible they go back to those habits.
Yes, the ministry, it's an holistic approach to treatment or rehabilitation. So there is a unit called Human Integration.
Okay.
So they do a follow-up
for
all the rehabilitees that have gone through our rehabilitation center. So just to monitor, supervise, and see how they are faring. In fact, about a month or 2 months ago, there was a program organized for all the discharge rehabilitees that are doing fine. We had a community engagement with them, just as follow-up.
Okay, meaning you keep in touch with them even after rehabilitation.
Keep in touch with the family to know the progress of what's on ground.
Okay. Now, talking about policy makers, how does LASKADA work with policymakers to influence legislation and policies, to address substance abuse in Lagos State?
Well, if you notice, I said it was just being revamped 3 months ago.
Yes.
So there are a lot of issues, or there are a lot of things on ground that need to be, addressed.
Hammered out, so to say.
Yes. One, there is need for us to engage with the census board.
Okay.
There are some movies, there are some adverts, music that are not supposed to be on our social medias. So these are some of the things we need to engage them with, engage with the House of Assembly on amendment of some certain laws.
Okay.
These are some of the things that we are putting together, and if you notice, the State House of Assembly has not really been sectioned.
Yes.
So those are some of the things that have been debarring our movement, but we already have some of those things that we want to present before them.
Okay. The fact that the unit has been revamped, as you said, it's a move in the right direction, and I believe everything will fall in place. Let's talk about what we visited earlier. I'm talking about collaboration with other stakeholders. We actually mentioned the NDLEA. So law enforcement agencies, healthcare providers, community organizations to tackle substance abuse. Can we tap a bit on that?
Yes, we have so many of them on board. Like we rightly said, we are having a collaboration with MTN.
Okay.
In a week's time, there will be a conference.
Okay.
On substance and drug and substance abuse.
Yes.
That will be held at Ikoyi.
Okay.
I think next week, Falomo, next week Wednesday. So most of the stakeholders are part of that conference. And August 5th, as part of our collaboration, we are working with a foundation called BHF.
Okay.
We're going to be having a youth conference on drug, cultism, and Yahoo.
Wow. The three-headed monsters.
These are the three monsters we are facing. So we'll be having a big conference that will be having most of the schools within District 1.
Okay.
So we're taking it one after the other. So with District 1, So we'll be having a conference with the students there so that they know the adverse effect of this menace. So we are collaborating with a lot of organizations, and our doors are open for collaborators to come and partner with us so that we can all fight this menace.
Because the government can't do it alone.
Of course, we need all hands everyone. What are the biggest challenges? I know there definitely will be challenges. What are the challenges facing your unit in its efforts to, combat substance abuse in Lagos State?
Well, it's a multi-agency sector.
Yes.
We need to work with Ministry of Health.
Yes, of course.
Work with Ministry of Education. But we need them to understand what our objectives are. So that's one of the challenges, having some MDAs.
Yes.
Keying into this vision. And probably, fund.
Yes, of course.
Is another big thing. Yes, we cannot go out there, advocate, and when we have people who are struggling with this thing, 2 rehabilitation center from the state is not enough.
Not enough.
Looking at the statistics we have, so there is need for us to establish more. So there is need for fund. That is where we need collaboration with multinational organizations to come in, maybe donate to the ministry rehabilitation center, and we can take it off from there. So, and so many other teaching challenges that we will be having.
That's a good way to describe. Okay, so I'm looking at I know we have people who are very influential. When I say influential, on social media and all that, also the community leaders that people look up to. Is there what role do you think they play in supporting your efforts to combat substance abuse?
We need them on board. Like most of these artists, musicians and all that, and particularly those that have gone through those rough life,
lived experience.
Yes. We need them to come on board, and we're already talking to some of them, and they are willing to.
Okay.
We're willing to be part of it and be our ambassador.
Oh, okay. So you'd have some sort of ambassadorship?
Yes. In fact, we've appointed a few ambassadors in the last 3 months.
Okay.
When we are at Surulere doing our community sensitization,
yes,
we appointed about 4 ambassadors there. At Mafoluku, we had 2. At Olaiya, we had 3.
Okay.
So that's how we're moving on with all these things. And some of these influencers, we need them along to move this idea. The conference I talked about that will be coming up in August.
Yes.
5th of August.
Danny Shoki is going to be part of our influencers at that conference.
Okay.
And these are some of the individuals that we're looking at that will move
that they wield a lot of influence on the younger generation. Okay. Can we talk a bit about plans? Now you've told us a bit of your plans for the future. Working towards your goal. Any other plans? Any other things in place?
Well, we are also looking at having research and statistics.
Wow. Okay.
We need to
that will be under the unit. Okay.
We need to evaluate some of these. Yes, we've been going out. We need feedback
and to know the trends.
Sometimes the trend might change, so that we'll know the kind of program we'll come up with.
Okay.
So, and at the same time, we need to also partner with the academic institutions in terms of research.
Okay.
So, LASU, Unilag, they are going to be partner in this progress.
Yes.
So we need, fund, and we need organizations that could also sponsor those research.
True.
So that we'll be able to have a specific and tailored program towards whatever the outcome of those research.
Okay. Now, for listeners who would like to support your efforts to create a healthy and safer and drug-free Lagos State, just to reiterate things, how can they reach out to you? to the unit, yes.
Okay, we've said it. They can write a letter to the permanent secretary.
To the permanent secretary,
then
okay.
attention LASKADA unit.
Okay.
Then they can call us.
That's
on
permanent
the number.
secretary of Ministry of Youth and
Social Development.
Okay.
Block 18, Alausa.
Okay.
And they can call us on our number 0903
Yes.
931 9183 or DM us on LASKADA laskada.gov.ng or both Instagram and TikTok.
Okay.
And they can also send a mail to us at laskadaunits@gmail.com.
I know a lot of people reach out to you on DM. DMs are easy to send. All right, it's been a great time on the show and really, really eye-opening. Dear listener, of course, we have come to the end of the show. It's been a good one. Well, statistics, really frightening. But of course, I know Lagos State is first above others and, making giant strides in, fighting against this hydra-headed monster. You mentioned the three, aside drugs, Yahoo, which is fraud and all that, and the primary targets are the youth. And I believe it's a good start in the right direction. I must say thank you very much, Mr. L.O. Kotun, Deputy Director, Head of LASKADA, and Mrs. Olaiya Martha, Principal Social Welfare Officer. Thank you for taking time out of your busy schedule, to come educate us. Thank you so much.
You're welcome.
And we're looking forward to having you on other editions of the show, if that is possible.
I'll be willing to.
Thank you so much. And dear listener, it has been an amazing time. That's all for today's enlightening edition of MYSD Spectrum. I must say thank you for joining me on this journey of discovery and exploration. Thank you for everyone that listened and those that sent the messages. We say thank you. And of course, a big thank you to my executive producer, Tayo Conley, and every other person out there on the team. Remember, social development is the foundation of a brighter future. Together, you and me, we can build a more inclusive and prosperous society. Stay tuned for more inspiring updates, insights, and success stories from the Lagos State Ministry of Youth and Development. I can't lose any signing.